Fantastic. Hello, everybody. Thank you so much for joining today. And a big thank you to Jody and to Dr. Han Qualls who put this together. We are in a very challenging time right now. And I have to say that when I told my family, it was at dinner, and it was the day that we had decided that I was going to participate in this and give this talk. I said, I'm going to give a talk on depression, and my husband started laughing, and he said, oh, are you going to start with like your head down on the table and your head in your hands? We'd had a particularly challenging day in our household with remote learning, have 2 teenage kids, and it just really reminded me that, I mean, everybody is struggling here, you know, to some degree now. And my understanding is I have a lot of service providers on the call and also some community members, and I'm hoping that what we talk about today, and I wish we were together as we could discuss this in person, but I'm hoping it'll resonate both as a service provider to help those with whom you work, but also just all of us as human beings, because I think, you know, I imagine that everybody on this call has had at least one moment where we have the head in the hands. If you Google depression and images, you will see a bunch of people with their heads in their hands. And I think that's kind of emblematic of what's going on for us right now in these challenging times. So I'm hoping that the information can be helpful, you know, and at least resonate with everybody on the call. Let me just see, I'm trying to advance my slides here, and let me see why there we go. So the depression, a lot of people will come to me and say, you know, I don't know if I'm depressed. What is depression? And there's something called the Diagnostic and Statistical Manual of Mental Disorders, and it goes through all the different criteria for depression. But so I want to start and talk about the symptoms of depression, not so much in terms of diagnostic criteria, but generally what we look for when we are worried or concerned about somebody having depression. And certainly, as I just said, in the context of the pandemic, I think, you know, a lot of people have a depressed mood at a minimum at times. I'm also going to discuss the role of grief and loss, and talk about some cognitive and behavioral interventions to address some depression symptoms, things that hopefully all of us on the call can use for ourselves as we navigate these challenging times, and also hopefully being able to pass this along to those with whom we work. And at the end, I'm going to talk about some community resources that I have found to be really helpful, both pre-pandemic and then during the pandemic. The silver lining, I think, or a silver lining that's come from all of this is there's been a lot of mobilization in communities trying to get useful online resources, and some of those have really been helpful, particularly for the people that I see who are very much homebound and isolated. Love this slide. How are you? Fine. You know, there are all these comic routines now where you'll see people masked up and huddled and saying, I'm fine, I'm fine, I'm fine. And most of us aren't fine right now. It's just the way it is. And so, you know, we kind of have this cultural norm in our society where we ask people, how you doing? And people immediately say fine. And so you can see here in this picture, just that really embedded in the word fine is a lot of unfine. And that's kind of what we want to try to help address. So like I was saying, there's something called the Diagnostic and Statistical Manual of Mental Disorders that talks about different symptoms of depression. And so I've highlighted a few of these. So obviously, when we're concerned about depression, we're asking about depressed mood. You know, do you feel depressed? Do you have a low mood? Diminished interest or pleasure. So people that were really interested in something have really lost their willingness or interest to pursue that. Obviously, during the pandemic, things that gave us pleasure or things that were interesting to us may not be accessible. And so we've got to be really creative about trying to help people reconnect with interest and pleasure now. Significant change in weight or appetite can absolutely be a symptom of depression. problems with sleep. There was a wonderful presentation about sleep earlier. It was, I think, the first one in this series, and I hope you were able to join that. Want to say that these talks that we're giving really hopefully overlap and complement each other. And so I won't be talking a lot about sleep, even though that's a big part of depression, because it was already discussed. The other thing that I'm not going to talk a lot about is anxiety, and depression and anxiety often are connected. But there's going to be a wonderful talk about anxiety too in the new year. And so just want to encourage you to either listen to the prior talks that have been recorded or participate in the ones that are going to happen in the future, because I think it's all really, really helpful information. You can have some physical agitation or slowing with depression, so people can be kind of listless and out of sorts and, you know, unable to stay still and just feeling agitated. Or you'll actually see a significant slowing, and that can be in people's language. They can have a hard time just being able to answer a question. Sometimes that can feel effortful when they're feeling depressed. And then also just their body movement, not the same kind of get up and go. And some older adults struggle with that to begin with, but you'll see a real pronounced or exacerbation in that symptom, if you will. And fatigue or loss of energy nearly every day. Feelings of worthlessness or excessive guilt, problems with concentration. So just ability to, let's say that you used to really love reading a book or reading the newspaper, and now just finding that really challenging to do and to stay focused. Irritability, that's a big symptom of depression among older adults. So people will say, if a family member is coming in, they'll say, I just, you know, my spouse, my partner, my mom is just really irritable. It feels like everything just sets her off. And so that's something that we see with depression for younger folks as well, but particularly in older adults. And then of course, there's always the possibility with depression of recurrent thoughts of death. So kind of a preoccupation with death or suicidal ideation. I want to just talk about how common depression is for older adults. I, as a geropsychologist, you know, I'll be somewhere in a social context, although not so much these days. People say, what do you do? And I'll say, I'm a psychologist. And they say, oh, do you work with kids? People, for whatever reason, will ask that. And I'll say, no, actually, I don't. I work with older adults. And sometimes they'll go, oh, that must be so sad. I think, okay, but no, it's not so sad. And they'll say, are they really depressed a lot? And the answer to that is actually no. Older adults in general are less depressed than younger people. And really 1 to 5% of older adults, when you look at studies, are depressed. However, when you add medical conditions in the mix, you add hospitalization or the need for home care, then you can see that those rates go up. And we have about 80% of older adults have a chronic medical condition, and 50% have 2 chronic conditions. So that does increase the incidence of depression when you have chronic illness in the mix. It's interesting with the pandemic, you know, the big question is, how is this going to impact mental health? And if you look on the news, you see all of these stories about, you know, increased depression and suicide risk for people. See it a lot for teens, actually, but for older adults as well. But there's still not enough research to really get a sense of what this is going to look like and how this is going to shift. One thing about this pandemic, as we all feel, is that we don't have a fixed end to it. It feels like it's going on for a long time. Some encouraging vaccine news, it sounds like, but it does feel like it's going on for a real long time, and there's uncertainty there. So there's ongoing research about how this is impacting older adults. And so there are some early studies saying that it is increasing distress in older adults, but there was also a study that was really interesting around older adults who are depressed going into the pandemic, actually come to the pandemic with a sense of resilience because they've been dealing with hard things as somebody who's depressed. Also, if you make it into your 70s or 80s, you've dealt with hard things along the way. And so this whole idea of resilience and what older adults bring to the table when we're involved in a crisis like we are now, it'll be interesting to see what those studies continue to show us. Some risk factors for depression among older adults. Female gender is a risk factor. Chronic medical illness, as I just said, pretty common for older adults to have a chronic medical illness, chronic health condition, and then pretty common for them to have more than one. Physical disability, poor sleep, as that was discussed in the first lecture. Social isolation, this is huge. We're going to talk about this a lot. It was huge to begin with for older adults, whether we're talking about loneliness or social isolation, but of course very much exacerbated now during the pandemic. A family history of depression can increase risk of developing depression. Substance abuse can add risk for depression, and caregiver stress. We see a lot about this with caregivers. And, you know, one thing that I'm seeing in my practice, I am in private practice and I do psychotherapy right now exclusively. So talking to people hour after hour of how they're coping with this. And the people who are taking care of somebody are really struggling, because now we don't have the respite coming into the home as much as we did. It's hard to go to senior day programming. There are different restrictions, and those are of course evolving. I know not everybody on the call is from Colorado, but we just had another step up of restrictions here in Colorado. And so people, when things are more restricted, then there's less access to resources, and that absolutely impacts caregivers. And I'm sure some of you on this call know way more about that than I do right now and are really feeling. We're talking about risk factors and protective factors. So risk factors really, you know, they're the same risk factors that we have for depression. And one point I want to make clear is that older adults, older white men are at highest risk for suicide. In fact, older white men that are 85 years old and older are at the highest risk group for older adults. And so those are folks that we really want to be particularly attuned to when we're concerned about suicide risk. So we've got depression and other mental health problems as a risk factor, substance use, physical illness, disability, pain. Pain is a big risk factor. Social isolation, which is obviously we can imagine makes things much more difficult now. Social isolation, like I said, really is exacerbated by the pandemic. And so we want to make sure for people who have a past attempt, as it says on the next bullet, we want to really be reaching out to these people. People have access to lethal means. A lot of people have guns, depending on what state you live in. Sometimes there's more guns in different states, and depending on what population you work with, veterans, for example, tend to have guns in their home, and we just want to be aware of that in terms of assessing suicide risk. Protective factors, engagement and care for mental and physical health problems. And this has become challenging now with the pandemic. People are not getting their routine medical care. A lot of times where people get access, obviously, to medical care, but also mental health care, are when they go to the doctor and they see their primary care physician. People are really backing away from that because they're concerned about getting the virus. And so we're losing the opportunities to engage people in care. And that, again, is a protective factor to keep people from harming themselves. Social connectedness is a protective factor, and for obvious reasons that's been impacted. And then just coping skills with adapting to change and coping skills in general. Next slide, please. Okay, great. These are some images that we've seen on the news. We see these images. This first one is just heartbreaking. You've got somebody hugging either her mom or grandmother wrapped in plastic with a mask on. This idea for the first time that people are actually phobic objects, which is crazy, right? That when we see people coming down the street, there's this visceral reaction of that they are potentially a contaminant. Yet we're talking in the slides before about how important social connectedness connectedness is. And so, you know, what a good image of a barrier, literal and metaphoric, of the social connectedness. Technology, which is hysterical because with what just happened with my internet at my home and other issues, technology is challenging. So what did we have? A delay of 10 minutes or so trying to get back up. And I know about computers and I know how to use Zoom, and we still had this difficulty. And so you think about people who have not learned these technologies, it's immensely frustrating for them to try to connect with care if they haven't learned it. I do really, really want to say, though, that telehealth, for people who are reluctant to engage older adults in telehealth, I really encourage you to rethink that. When this all started and I was going to have to go to 100% telehealth, I had never done telehealth before. I'd always been in person, still very much prefer in person. But I thought, oh my gosh, how is this going to go? This is going to be so hard for me, but more for them. And really, if it just takes some patience, really like 7 minutes, 7 to 10 minutes, sometimes 15, to help people connect with these technologies, whether we're talking about Zoom or FaceTime or Google Duo on your Android. There's all these different ways to do it. And when we can get people connected on technology, we can actually see them, it helps so much. And older adults are amazing at this. I have clients who are in their 90s who are readily using Zoom and other technologies to connect. One of the sweetest things that happened to me at the beginning of all this is I was working with a woman who's very reluctant to try this. And I said, oh, just hang in there with me. Let's see if we can get this on your smartphone, that she, of course, barely had used before. And she saw me and she saw her little square of a picture. And she said, oh my gosh, do you think I could do this with my sister who lives on the East Coast? And it just opened up the world for her during this. And so really, for all you service providers, if there's opportunity to sit with people and get them hooked up to these things, once they do it 1 or 2 times, of course, this is barring significant cognitive impairment, people really, really benefit from it. Next slide, please. Great. So COVID-specific challenges for older adults. Repeated messages about being the vulnerable population. This is fueling depressed mood for a lot of people. At the very beginning of this, right, and throughout, it has been older adults are vulnerable. They should stay home. They shouldn't go outside. You know, out of everybody, they should be the ones that don't do things because of the risk. And that's real, right? We have 80% of the people who die are older. And so historically so far with this. And so I've had so many clients say, I'm so tired of being labeled as vulnerable. I felt vibrant and engaged before all this, and now I have this label, and that's just really hard. Isolation from friends, family, including adored grandchildren. That's one of the hardest things for people. Pre-pandemic, about 40% of older adults reported feeling lonely. This is pre-pandemic. And so we can imagine the pandemic on top of this makes it that much more difficult. And like I said, people are now viewed as phobic objects. So it's this mixed feeling of I want to connect and hug and be with people I love, but I'm scared of them at the same time. Not going to talk too much about this, but there's increased family relationship struggles, and Dr. Hung Qualls did a wonderful presentation about social connectedness and kind of the challenges there. One thing that's come up for me in my practice is listening to people talk about how either their family member views the risk of the virus very differently than they do. And so they either want them to be more careful or less careful, or the family coming in and out of the house aren't being careful enough, or they're being too careful. So people have different perspectives about this. And then also just the lack of autonomy. You know, I had at the beginning, I get to see people on video. And so I'd say, oh, it looks like you got a haircut. And there was this sense of, well, don't tell my daughter, and I don't even talk to her daughter, but this sense of I did something bad and I didn't get permission from my family member to do this. And so there are already role changes as people get older, but now there's this added layer with the virus of they're kind of telling me what to do and not do. Sometimes that feels nice because they feel like they're being cared about, but sometimes it can feel really isolating and upsetting. Next slide, please. Grief and loss, this is its own discussion. In terms of, when I say its own discussion, we could talk about this for an hour easily. So I'm gonna just hit a couple of points that I think are important for us to keep in mind. Obviously, people are dying from this, and people are grieving the loss of loved ones. We can't do the rituals that we used to be able to do because of inability to travel, inability to gather for funerals. And so this is really complicating the grief process. Elizabeth Kubler-Ross is a very well-known researcher in grief and loss, and you guys are probably familiar. There are some stages of grief: denial, anger, bargaining, despair, and acceptance. And it was once thought that with grief, we go through these stages, one at a time, and there's a certain amount of time that you spend in denial, a certain amount of time that you spend in anger. And what we've learned over time is that that's not true. It's really kind of mixed up, and you can jump from one stage to another. There aren't specific times necessarily. I mean, I think probably everybody on this call has experienced a loss in their life. And, it can be 10 years later and you smell something or you hear something and you are leveled, you're brought back right to that grieving place. And so when we're talking now about grief related to COVID, and obviously this is for more, beyond COVID, but to just remember that there's no right way to grieve, there's no wrong way to grieve. And what we can do is just, at this stage, especially if it's related to COVID, just sit with people and listen. A lot of what I've been doing when I'm talking to people who've lost family members related to COVID, or even losing family members totally unrelated to COVID, but during COVID, so they can't fly to the funeral, they can't gather with their family, is we spend a lot of time reminiscing about that person. And that has been incredibly important, and allowing some time and space for that. There's something else called ambiguous loss, and I put the website there, ambiguousloss.com. Pauline Boss is a researcher, and when I read about this, I thought, wow, that's so helpful, because I work with a lot of people who are caring for somebody with dementia, and the grief and loss that comes with caring for somebody with dementia is a real unique loss, and she describes it as ambiguous because it's characterized by both presence and absence. The person is still there, but they're gone. And she's likened this, or she's applied to this concept to now the pandemic. So we kind of have a loss of a way of life, a loss of freedom to move about the way we did, a loss of rituals, yet we think we might get some of them back, but maybe not. And so it's this very ambiguous state. And I think it's a really good way to think about loss and be able to sit with people in that there's not kind of a predictable way to respond to it, but it's something that we want to acknowledge and again allow time and space to talk about. Oh, sorry, next slide, please. So I'm going to try not to be too fast in my talking about this, but I realize our time is shorter, and to talk about cognitive behavioral therapy. So this is one of the most common therapies that's used to treat depression. Obviously, we're not going to go in great depth, but I'm hoping I can leave you with a couple of interventions to either pass along to colleagues and to the people with whom you work, but also just for yourselves during this challenging time. Cognitive behavioral therapy was pioneered by Dr. Aaron Beck in the 1960s, and there's actually something called the Beck Institute, and I put down below beckinstitute.org. You can look it up more if you're interested. But it's based on what we call the cognitive model, and this idea is the way we perceive situations, so how we think about situations influences how we feel. It's a really important point, and I could repeat it 500 times, because it's really, once we really understand that, it's powerful. When people are distressed, perspectives can be inaccurate and thoughts can be unrealistic. And so CBT, the goal of it is to help people understand and identify their distressing thoughts and evaluate how realistic those thoughts are. And I'm going to give some examples as we move forward. The goal is to learn to change the distorted thinking and arrive at a more balanced perspective. Because if we have balanced thinking, then our mood is less impacted. Next slide, please. So here is just a picture of the cognitive therapy model, just to kind of think about as we're discussing this topic. So thoughts create feelings. So we have a thought about something, It impacts how we feel. The feeling creates behavior, and the behavior reinforces the thoughts. And so we're in kind of this feedback loop that can be really helpful if you're having certain kinds of thoughts, but can be really problematic if you're having other kinds of thoughts. Next slide, please. So there's obviously with cognitive behavioral interventions, I'm going to start talking about the cognitive part. So cognitive thinking, what thoughts we have. So one of the first steps is to identify what automatic thoughts we have. Before you got on this call, you had, if I jumped in your head, and this will be different for everybody, you had a lot of automatic thoughts, and they might have been, gosh, I have so much going on right now. I can't imagine sitting through yet another Zoom call. I don't know that this is going to be helpful. Or, geez, a friend of mine is really struggling with depression, and I think I could maybe get something useful from this. I'm looking forward to this talk. So you can imagine all the automatic thoughts I had when my internet connection failed. So there's a lot of thinking that happens for us that's automatic. It's like a ticker tape. And if we got into each other's heads, we'd probably be pretty surprised of what we heard, or what the thought is saying. So part of it is recognizing, are there certain patterns that we have in our thinking that are creating some negative feelings? So for example, there are different categories of thinking processes that can lead to depression. So one is all or nothing thinking. And so this is seeing things in black and white categories. This will always be horrible. Things will never get better. So if we think about this in terms of the pandemic, it's easy to get into that kind of thinking at times. Another category of this type of thinking that leads to depression is overgeneralization. So this idea that one negative event will create a never-ending negative pattern. This happens for people when they have physical issues. So they'll have a back injury, and it'll be, I'm never going to be able to do anything active again. My body, I'm a lemon. My body isn't working well. So you take one event or one symptom, and it generalizes to everything. And then you have jumping to conclusions and mind reading. So this idea that we know how things are going to turn out, and we know it's going to be terrible, regardless of the lack of evidence. And people who are depressed will often engage in these kinds of thinking patterns. And certainly just all of us, I'm sure, we can all come up with times where we have engaged in this kind of thinking. So the task is to, one, recognize that you're thinking that way, and then to challenge the distorted thinking. And there are a couple of questions that can be really helpful. So do I know for sure that X is true? Do I know for sure that, I'm going to be disabled for the rest of my life? And usually when we put these questions back on ourselves, it allows for some wiggle room, even if that's just 1%. If you say, well, I'm 99% sure that I'm going to, not be able to do this for the rest of my life. But that 1% allows for some wiggle room there. What evidence do I have for this thought? How realistic is this thought? Could there be any other explanations for this thought? And we're going to go through some examples in a minute. And is it useful for me to focus on this thought? I mean, all of us, I'm sure, myself certainly included, will get really mired in thinking about something related to the limitations that are going to be imposed on me. And is it really helpful to do that? Often not. Next slide, please. So one of the main points, if you can leave this talk and remember one thing, thoughts impact mood and behavior more than the actual situation. So you can have the situation, you can say, well, COVID is really a huge bummer and it's making a lot of people depressed. In part, that's true. But the way we think about it and the way we behave in it will impact our mood more than the situation. So, you see this where two people go through the identical situation and have a very different response and a very different emotional experience. And that's because the way we think about things impacts our mood more than the situation. So just if there's one thing you leave with, that's an important point. I want to give you just some very specific examples. So let's do example number 1. So the virus hits a new record, which it is doing all the time. So there are a couple of ways to think about that. One would be somebody thinks, oh my gosh, this is never going to end. I'm never going to be able to leave my house safely and be with my family again. And the resulting feelings, if you think about that thought, might lead you to feel hopeless and helpless and trapped. Horrible feelings, really, really heavy and trapped. Another way to think about this is to say, this is going to continue to be challenging. So you're not saying, oh, everything's fine, because everything is not fine. But you can say, and I know how to keep myself safe until the vaccine's available. We know better how to do that. And I'll never take for granted being with my family again. When we think about that and we take our mind to that place, a resulting feeling might be gratitude, feeling grateful, feeling capable, that you know you can do something to keep yourself safe, and then cautiously optimistic. And I say cautiously optimistic because, again, it's not all roses and rainbows here, but it is a way to kind of shift the way we're thinking. Next slide, please. Another example that's not COVID related, this comes up a lot with people I'm talking with. They're trying to connect to with their grandkids, so important to them, and the granddaughter doesn't call them back, doesn't text back, doesn't respond. One way to think about that is, I'm irrelevant to her. She has no interest in me anymore, right? When we go to that place of, she doesn't care about me, I might as well just not even try. The alternative thought is, well, okay, she's a teenager. This is the whole what's another explanation for this. She's a teenager, a lot going on. I think I'll call her again, see what she's up to, so she knows I care about her. And those feelings, instead of feeling rejected, abandoned, and inadequate, we feel curious, engaged, loving, and empowered. So I'm really hoping that I'm not trying to say that this is really easy, like think positive thoughts, but it's more of, can you entertain other explanations? Can you think about it differently so that it balances itself out and you have a resulting shift in your mood and the way you're feeling. And then it also leads to different behavior. So now you're reaching out to your granddaughter again instead of retreating. Next slide, please. We talked about the cognitive part very quickly, and now we're going to talk about the behavioral part of cognitive behavioral therapy. So the behavioral part is something called behavioral activation, and basically that's like, do something. Let's get going with something. At its most basic level, when people are really depressed, we're trying to get them to shower. We're trying to get them to brush their teeth. It's designed to address the avoidance and isolation that fuels depression. If we avoid things and we stay in our bed and we isolate, all that does is kind of drill us down deeper with depression. And so right now we kind of have to dig deep here sometimes to figure out, how do we get people activated, because there are a lot of limitations now. But so some ideas. So we want to get people to identify what might be pleasant for them. And these can be simple things. There's something called the California California Older Adult Pleasant Event Schedule. There's lots of different pleasant event schedules, that's what they're called, that help us identify what it could be helpful to somebody or what could be pleasant. The way this measure works, and I have a link to it at the end and also on the handout that I gave you, or that Jody was able to attach to the call today, the Zoom invite, is that it looks at different activities, and they're not activities, that maybe we would do for a 20-year-old, go for a run, something like that. That's not what these are. One example of an item is looking at clouds, and what it does is it lists a bunch of different activities, and it asks the person two questions. It asks, how often have you done this in the last month? And how pleasant was it, or would it have been had you done it? And what we're looking for there is, can we identify some activities that somebody deems pleasant, but that they're not doing very much of? And we want to just try to increase that. And like I said, these activities, by and large, there are some that are not okay for COVID, but by and large are things that people can do in their home that are readily accessible. Sometimes we forget what's accessible to us. And sometimes as care providers and friends, we are in a position to be able to say, remember, you really liked to do that. Let's get you doing that more. So that's part of behavioral activation. We also can use literally your day timer, and you ahead of time, like the night before, you write down 2 things that you're going to do, and you actually roughly indicate what time you're going to do them. I feel best in the morning. My body feels best in the morning between 10 and 11. That's when I'm going to go for a short walk. And we actually schedule that for ourselves. It can help increase the likelihood that we'll actually do it. And so we can help people do this. The other thing with behavioral activation is we want people to activate their five senses. And so, what can we do that's pleasant? And we're going to get to a gratitude exercise in a minute about our five senses, but what can we do to shift our body almost as a reset button? I think we all need reset buttons sometimes of like, wow, I'm getting really mired and heavy in all of this. I need to something needs to reset me. And that might be going and getting a cold glass of iced tea, having a cup of tea, taking a hot shower, splashing water on our face. That's a big kind of jolt of a reset, but that can be really helpful of getting us shifted. Exercise, that's important. We know that's a whole other discussion too. People are having a harder time exercising, like going to rec centers and things like that. One thing I'm having people do, if they're able with their balance, are sit to stand exercises. Just, and we actually will just demonstrate it. I'll say, okay, I want you to just show me right now that you can sit and stand up. It sounds so little, but if people can do that and build some strength, and it acts as a reset button as well. Next slide, please. This is an exercise that I do with people that you can do yourselves. I really encourage all of us to do this periodically. It's a sphere of influence exercise. What we do is we give somebody a piece of paper and we ask them to put a circle in the middle, and we ask them to put everything that they have control over or where they can influence in the middle of the circle and everything else on the outside. With everything going on lately, with the pandemic, with the political landscape, the layers and layers and layers, most things fall in the category of everything else. And sometimes having a picture of that's been really helpful for some of my clients to say, okay, wow, most of my energy and mental energy is going into this everything else place where I have zero control. And where can I have control? And how can I make the list longer of where I have control? Next slide, please. So once you've done this, I'm going to just do a quick example. Where I have control might be I can eat something healthy today. I can go for a short walk. I can call my granddaughter. I can wear my mask when I go to the grocery store. Like these things that we have control over. Everything else would be what happens in the stock market, how my adult children raise their kids, when I'm going to get the vaccine. These are things that we cannot control. But so we try to ask ourselves, where's our energy going? And how can we redirect it to the center in the places where we have control, in the places that we value? Next slide, please. Gratitude. I talked about gratitude with my family and I get some eye rolling, my two teenage kids, but it's where it's at. There's a teenage saying of, this is it or this is not it. That's not it, but this is it. This is where we have the energy, and it's within us all the time to focus on what we have instead of what we don't have. Next slide, please. So want to just talk about the benefits of gratitude practice quickly, and I'll skip over the research part, but what we know is that it helps reduce aggression, it helps increase empathy, so us to care about people more, it increases our mental strength, it promotes social connection, it helps us delay gratification, and again, it helps us focus on what we have versus what we do not have, which is really important. Next slide, please. Couple of different ways to do gratitude practice. You guys have probably heard of the gratitude journal. Many of you on the call may already do this, where you set a specific time and you write down what you're grateful for. There's lots of different prompts. You could just say, what am I grateful for today that happened? So it can be very open-ended, or you can get very specific. And we're going to do a specific exercise in a second. You can also do letters of gratitude. This is so lovely. And if you can imagine receiving one of these where you write a letter to somebody, it can be anybody, and you write about what they've done for you and what you appreciate about them and how they've impacted your life. And just imagine right now and these times going to the mailbox and getting that letter from somebody, and then what you get in writing that letter. Hugely powerful. There's all kinds of research on the benefits of this. There's also gratitude meditation, where there's actually scripted meditations that you can do, or you yourself can sit and meditate on something that you're grateful for. I put in, and this is in the attachment too, on the community resources, but Greater Good in Action as an organization through UC Berkeley that has that link. There's a guided meditation that you can listen to about gratitude that I think is really lovely. This one I want to share with you now, and I know we have 3 more minutes. I know we can extend the call, which we will do, but I know some people will probably have to get off, so I want to run through this very quickly. It's really wonderful to connect with things that are already within us or readily accessible to us. And so to sit down and to say, what are 3 things that I love to see? And you just identify what those things are. So it might be the view outside a bedroom. It might be this beautiful, somebody yesterday said they have this beautiful antique bench that they got from Germany, and every time they walk by it, they love it. So we identify 3 things that we can see, and they can be things that you remember seeing. So when my granddaughter got that award at school and I saw her beaming face, like I can still connect with that, something I'm grateful for. What are 3 things that we love that we can hear, taste, feel, and smell? When you do this with somebody or even yourself, what you will see is this notable softening when people do this. And, you know, rarely do you get pushback. People might think it's a little hokey, but then as soon as they start talking, you see this softening. And you'll see when you ask people about what they love to taste or feel, you'll actually see them, it's like they're giving themselves a hug. They kind of can connect with these experiences. This literally changes our brain chemistry and changes our physiological reactions when we can connect with gratitude. And so just really encourage you, that's something that we can give the people with whom we work and the people that we love in our lives, a way to connect with something that they always have accessible. And some people might say, well, I'm grateful for that, you know, that I can go to Hawaii once a year and now I can't do that. True, but we want to widen that list a bit, and it's easy to do with just some time and patience. All right, next slide, please. Okay, wow, I feel like I just spoke very, very quickly because I did. These are some community resources that are available, and I have found them all very helpful. So using technology, these are AARP and Senior Planet. These are organizations that will help for free seniors learn technology. So whether we're talking about Zoom, FaceTime, it's, you know, the one-on-one patience and having time to walk through things with them. Really, if you don't have time to do it, there are some options. Educational classes and group support that's online. This is around the behavioral activation piece, right? Trying to connect people to something that's interesting for them. OLLI, if people aren't familiar with that, Osher Lifelong Learning Institute, organization that's often connected with major universities and cities, but it's online and they have classes that are offered. And then something called Well Connected, which is a lovely resource through an organization called Covia, and they do classes and support groups, tons of them, something almost every single day that an older adult or anybody can log on and partake of. They also do it just phone only, because a lot of this stuff is extreme, you know, online and video, and some of our older adults don't have access to a camera on their computer or their phone, and so this they can log on just with phone. So really encourage you to pass that along. Next slide, please. Connections plan. There's a woman named Kim Van Orden, and she runs this Hope Lab in the University of Rochester. And there's a YouTube video that pretty much kind of summarizes and puts into action a lot of what I've been talking about around how to have a plan to activate older adults and connect them with things that are meaningful. And so it's just another resource that kind of captures what I've been talking about. Gratitude resources, positivepsychology.com, great website for gratitude prompts, tons of them, reams of them, all kinds of YouTube videos and clips and ways to engage young kids and grandkids and all of this around gratitude. It's beautiful. And then I'm ending, gosh, on a hard note, but if you don't have this number, it's really important to have. So it's a National Suicide Prevention Lifeline, important to pass along to other service providers if you don't already know it, and community members. That staff 24 hours a day, 7 days a week. Okay, that is the end of my talk today. I don't know if we want to have some time for questions.
If you don't mind, we're going to spend about 5 minutes. I know there's some folks that have had to jump off since it's 3:02. If we spend about 5 minutes, and then if there are some questions, Dr. Gilliff, that we don't get to, do you mind if we send them to you and then we can answer them directly?
Absolutely,
So,
absolutely.
okay, that's terrific. So hold tight here. We are going to go back up and see. And there are some wonderful, you can't see this, but there are some wonderful support comments in here about the technology. And they said, don't stress, you are doing great. So
thank you.
So we had a very supportive group. So and there was even a comment about thanks for bringing up bright spots to our behavior and to help us find a balance. So
wonderful.
I want to make sure that since you can't see those, that you know that they were supporting you in cyberspace. Is there a time of day that has been shown to be best for gratitude practices? Is it maybe first thing in the morning, or is it best to do it closer to bedtime?
That's interesting. I don't know that I have an answer to that, but I will say kind of anecdotally in working with people, it really varies. I'd say it's one of those two. So I wouldn't say it's probably in the middle of the day, but generally when people are going to bed or when they're waking up. The great thing about doing it, and ideally you do it both times, if you go to bed with a place of gratitude, it helps you sleep, but it also kind of sets the mood and the tone for the next day. Same thing if you do it in the morning, it really sets the tone for your day. The mornings right now, people are having, well, people struggle both in the morning and at night, but people will talk about when they're depressed, they wake up in the morning and it's just this, oh my gosh, another day. How am I going to possibly do another day? And I'd say by and large, the folks I'm talking to, gratitude practice in the morning is most helpful.
Terrific. And one more here. If a thought creates a behavior, can a person just change that thought right away? And will that behavior automatically change, or is it much more progressive?
I think it depends what it is. I mean, that could happen. I mean, you could have an experience where you're having a thought and you can catch it. They talk about catching thoughts, where you notice like, okay, this is really not helpful. And if you can change it and reframe it in a way, especially that really resonates for you, that might really change your behavior. So, you know, that could be around, let's say you learn some you're having a thought about your health and that you don't want to take care of your health. And then you talk to somebody and they give you a different perspective around, well, actually, if you know, keep up and don't get diabetes, then you're going to be able to be, you know, more involved with your grandkids, and you connect with that and it really resonates with you, that might absolutely shift your behavior, and that might happen right away. Usually it's a little more of a learning curve, I think, and a reminder, and that's why the first step is this idea of being really cognizant of our thinking patterns and really realizing what those are. Some people can do that right away. I can sit with them and say, so this kind of thinking trap, what do? You do that all? And I've been thinking, do you do that? And some people will right away be able to say, yes, oh my gosh, I do that. And some people say, I don't really know what I think about or my automatic thoughts. So sometimes it takes a while just to even identify what those thoughts are before we can start changing them.
Well, that's terrific. It's 3:05, and we certainly want to be sensitive to everyone's busy schedules. So we'll stop there, but thank you very much to everyone who's still on the Zoom call for your patience today. Technology is sometimes not our friend, but Dr. Gilliff did an amazing job hopping back in and picking up where she left off. So a big thank you to Dr. Gilliff for joining us today and sharing her expertise. A reminder that there won't be a webinar next week due to the Thanksgiving holiday. However, we will see everyone on December 3rd for a discussion around the impact of substance use in older adults. So with that, have a very safe and happy and healthy Thanksgiving, and we look forward to seeing you all December 3rd. Thank you very much.
Thank you.